Welcome to Bear in Mind, the Brown Psychiatry Podcast, clear, current content about mental health. I am the host, Dr. Tracy Guthrie, Psychiatry Residency Program Director and Co-Editor-in-Chief.
I'm the co-host, Dr. Camila Cosmo, Brown Assistant Professor and Co-Editor-in-Chief.
I'm Anupriya Gogne. I'm an assistant professor at Brown University as well, and I work at women and infants with pregnant and postpartum moms.
Thank you so much for joining us. First, a content warning.
In this episode, we will talk about sensitive topics, some of which you may find triggering. Our only purpose is to provide education and information. Our content is not to be considered medical advice. Picture a constant traffic jam of thoughts in your mind and restlessness in your body that feels nearly impossible to control. Now, as you experience it, imagine being told to remain seated, focus on one thing, and patiently await your turn. This is often the experience of those living with ADHD or attention deficit hyperactivity disorder.
ADHD is a biological disorder and affects the ability to pay attention, control impulse, and stay still. Patients often find it difficult to concentrate on tasks, follow through with their responsibilities, or think before they act. And from an outside perspective, people with ADHD might seem restless or full of energy and can appear to zone out when they are expected to concentrate.
So as you can imagine, this can dramatically impact the person's quality of life, particularly at work and in school, in relationships. However, with timely diagnosis and proper treatment and steadfast support, individuals with ADHD can often achieve a reduction in these symptoms, learn strategies to manage their challenges, and live very successful lives.
And today we are glad to welcome Dr. Gogne, a psychiatrist at Women and Infants Hospital and Assistant Professor of Psychiatry and Human Behavior at Brown. She is currently writing a book about ADHD, and it's here to help us understand this complex condition. So welcome, Dr. Gogne. It's great to have you.
Great to be here. Thank you.
So what is ADHD, and how can we differentiate it from regular distractions?
So ADHD is a brain condition, a condition of the brain where certain aspects of the brain functioning are affected, like ability to focus for long periods, ability to stay still, ability to manage our mood, our anger, irritability, ability to just function day to day. It's stuff that seems common sense to most people, but flows smoothly for most people, but not for the person with ADHD. So, it's a very treatable condition of the brain.
Mm-hmm. And what steps can people take to find out whether they have ADHD and start treatment?
So the first thing people can do is talk to their primary care doctor if they are suspecting that they might have ADHD, whether it is a child or an adult, and they can be referred to a psychologist. And a special type of psychologist, a neuropsychologist. And, they'll do something called as neuropsychological testing, which is basically just a test, nothing invasive, no injections, no procedure. You just go and they will ask you some questions. They will give you some interesting things to do, tasks to do. And then they will tell you how your brain functions, basically.
Mm-hmm. And is this test required for the diagnosis?
Not at all. It is not a requirement. In fact, in adults, it might not be helpful every time to do it. But it can be helpful to clarify diagnosis because it can overlap with many other psychiatric illnesses. Mm-hmm. So in those cases, it might be helpful.
And could you clarify how this test works? Is it a paper and pencil? Could you tell a little bit about what you could expect of that?
So usually how it starts is like an interview. It's a process over a few visits with the psychologist. They will ask you about your mood, about your day-to-day functioning. And then based on what difficulties you're having, they will give you certain tests where which will test your memory. Some of them will test your memory. Some of them will test your ability to stay focused. For example, they might tell you a story and then test your recall, like tell you to repeat it after some time. And they will give you scores based on how you do. And that basically just tells us, okay, all these different parts of the brain are functioning in a certain way. And these are your strong points and these are your areas of weakness maybe. And based on that, we can structure treatment.
Thank you.
And are there different types of ADHD?
Yes. So, I think over the years, there's been different classifications of ADHD. According to the DSM, there is the hyperactive impulsive type, there is the inattentive type, and then there is the combined type. And some of, this classification can be helpful because some types are more common in a certain population than others. For example, in girls and women, the inattentive type is more common, and it presents slightly differently from the hyperactive type that you might have seen, the traditional kind of idea of ADHD, a boy jumping around in class. Mm-hmm. That's not always true. For some people, zoning out is more common instead of like too much activity outwardly.
Mm-hmm. And how does ADHD impact a person's daily life, relationships, and overall well-being?
It can affect a person a lot. It can be really disabling if it is not treated, right? So on one hand, I believe, it's not a defective brain. It's a different brain if we think about neurodiversity. But on the other hand, if we don't help this person with regulating their mood, with maintaining focus, really day-to-day things that seem trivial to us can become very difficult, like paying bills on time, driving somewhere safely, being on time for appointments, just adulting. Adulting can be very hard if it is not treated.
So a lot of people still think that ADHD is something only young boys get and eventually grow out of. And what would you say to them?
So I would give them some updated data. There's been more research in the past couple of decades where we now know that more than this group of people can be affected. Firstly, adults can be diagnosed for the first time. It doesn't mean that it started in adulthood. It just means that it was diagnosed later on. Also, we now know that it presents differently in girls and women. Mm-hmm. And now there's all this new data about how it presents in girls and women. So it's not limited to boys anymore. And it's not just a childhood illness anymore.
We know that diagnosing adults with ADHD can be a challenge. So what is the most common presentation? And you mentioned about people presenting symptoms since the childhood, but could it be the case that some of them were able to develop coping mechanisms and over time they were off? So could you talk a little bit about the most common presentation, also the challenges and why it's so hard to diagnose adults with ADHD?
Absolutely. So I'll start with the last question first. But it is hard to diagnose sometimes because it's important to remember ADHD is not a condition of intellect necessarily. If it's there by itself, it's a problem of performance. So mostly people know what to do, but they cannot, for some reason, they cannot just do it. So it's a disorder of performance, right? And so, if we think about the day-to-day of an adult, what it might look like. So firstly, it can affect your work life, right? So at work, you can lag behind on certain tasks. You might be staying till 7, 8 o'clock at night, extra hours to finish your work. You might be constantly distracted if you're sitting in class, if you're trying to focus. It can affect how you interact with people. You can seem rude if you're interacting and then you're interrupting people because you had a thought and then you feel like, I just have to say it at that time, right? Mm-hmm. So the ability to stop ourselves is missing. It can also affect relationships, right? So if a person is not treated, their mood can really go up and down quite a bit. Right, and so people will say they are having mood swings. They might feel irritable. They also might struggle with anger issues. Mm-hmm. And so that can really impact relationships because a person can really get angry very quickly and very intensely and not be able to control their behavior. So in worst cases, it can lead to even violence. So, the ADHD couple in which one person has it and the other one doesn't.
Just spectrum. I think that's a good word for it because you can have people who are just inattentive and they're maybe forgetting to do things, follow through on things. And you can certainly have people who are having mood issues and irritability and agitation and frustration. But not all people with ADHD have every symptom. Not everyone with ADHD has irritability or anger or frustration that can lead to agitation and violence. So we want to be clear that there's quite a spectrum with what happens with people. And the other thing that you were talking about that's interesting is, the coping skills that people can develop around this can be quite significant. And so it's not until there's a change in their life, right, where they're in a different job that now requires them to sit. They're a manager now, whereas before they were doing something very physical and out, following up, doing things. Now that they have to sit, they're not as productive, they're not as good. And people say, what's happening? You were doing so well, and you're just having trouble with this transition. And they work harder and try harder, and it's frustrating and fatiguing. Yeah. Very, very fatiguing. So it's just to emphasize what you're saying about there's a spectrum and the coping skills, I think, and changes that happen where the symptoms may start to appear, where you're wondering, what's wrong with me? Is this something new? It may not be new. It may be that it's been there all along, but you've coped with it, and now you've overcome your coping mechanisms.
Yes, or there's a major change in your environment. Like for the moms I treat, suddenly now there's a baby to take care of. Suddenly you're also sleep deprived. Your hormones are all over the place. Yes. So all those factors kind of affect the way it would appear.
So is ADHD linked to other mental health conditions?
Yes, untreated ADHD can lead to a lot of other psychiatric problems. For example, kids who are not treated, they are more likely to get into traumatic situations. It could be physically traumatic if they're taking risks and getting into situations where, traumatic brain injury can be part of it. Or emotional trauma, there's higher rates of bullying of kids who are untreated. There might be harsher punishment for kids at home or in school. So, and then we know that girls and women particularly internalize guilt, internalize shame. So a lot of women that I see, they describe this kind of a tape in their mind that they develop of negative self-talk. And it keeps on playing. And over time, as they compare themselves to other children of their age, their counterparts, it builds on, right? And it can affect, it can lead to clinical levels of anxiety, depression even. It can be very isolating if the person cannot really confide in anyone or they don't understand it themselves. It can also, like I said, affect relationships. So over time, there can be trauma within the relationships in how they relate to other people. It can seem like unstable relationships.
So I'm wondering if you can talk a little bit about some of the common comorbidities that we might see, the common co-occurring conditions that we might see with people who have ADHD.
So common diagnoses that a person with ADHD can have are anxiety disorders, firstly, like generalized anxiety or even OCD. They can have mood illnesses like depression can happen, but even bipolar disorder can be comorbid with ADHD. Like I said, exposure to trauma is there, so people can develop PTSD over time. People can also develop, if this happens when their personality is forming, they can develop personality disorders like borderline personality. So yeah, all these things can co-occur, and they can have overlapping symptoms as well.
So talking about comorbidities, you were mentioning about like the most common ones that are associated with ADHD. In thinking about the treatment approach, what do you think that should be a priority? How you usually do that when you have patients that has other conditions besides ADHD?
So when I get a patient, it's important to remember that in adults, the ADHD symptoms might not be the presenting complaint. It might be anxiety that they are having secondary to these untreated symptoms. They might be depressed. In fact, a lot of adult women that I see, they present with anxiety or depression first, or relationship instability or mood instability. And so first, it's important to evaluate fully, do a full evaluation. We do our own evaluation, which is a full psychiatric evaluation, ask some questions which are more kind of medical history and their day-to-day functioning and psychiatric symptoms. If I'm not sure about the diagnosis, then I might refer them for neuropsychological testing. Or if they've had like a major head injury or something that I feel like might have affected them, then I might refer them for particular pinpointing where they're having a problem exactly.
I see.
And then, treatment doesn't necessarily have to wait for the testing report to come back because it can take a couple of months. But treatment is medications as well as forms of psychotherapy, ADHD coaching. There are so many resources available now, so many gadgets, so many apps, so much support for people with ADHD that medication is only part of the treatment. But there is a lot that we can do in addition to medication that will help. And actually it's evidence-based, like mindfulness or CBT. These treatments have evidence in ADHD as well.
So are there particular apps that you have that patients have told you have been very helpful?
So one app in particular that I have read about, and it's on the attitudemagazine.com website, which is an extremely helpful resource, both for children and adults. It's called Inflow.
Okay.
Talking about treatment, I know that you just mentioned some options, but could you talk a little bit more about what kind of treatments are available for ADHD and how effective are they?
So there's many treatments available for ADHD. When I think about, so they can be medication management and types of psychotherapy, like I just mentioned. When we think of medications, we have non-stimulant medications and we have stimulant medications. Non-stimulant are medications, common ones are Wellbutrin, Strattera, atomoxetine, which are basically non-addictive and effective for, and all of them act kind of in similar ways but intricate differences. And then there's stimulants, which is the Adderall amphetamine class and the methylphenidate class. And then there's different brand names and different formulations within that. So really depending on what tasks the person has difficulty with, what time of the day is the most challenging. Like for my moms, the moms I treat, like the dinner time is particularly difficult when their kids are back from school. They have way too much energy. They have to focus on cooking. And so that time they really, really have trouble with distractibility. And so it can be helpful. I tell them to take it like half an hour before the kids get home. But for a person managing stuff in an office, it could be something completely different. And so we can also teach people how to use the stimulant medications. They don't have to take it every day. And that is a way also to reduce the chances that they might get dependent on it.
So yeah, the timing can be really individualized for these medications. Are there certain side effects, particularly of the stimulant class, since that's got sort of the same sort of profile? The other medications have very different profiles. But for the stimulant class, are there side effects that you look for and you warn patients about?
So stimulants are activating medications firstly, right? So one thing that can happen is people can sometimes feel more anxious. They can feel more irritable. So like the mood can get activated a little bit too much. They can disturb sleep. So sleep disturbances can be part of ADHD symptoms, but if the person takes the stimulant too late in the day, in the evening, they won't be able to sleep, right? And then it won't be helpful. They can reduce appetite. So some stimulants are used for actually weight loss, but if they are overused, the person can really lose a lot of weight, which is a state of malnutrition we don't want. Cardiovascular effects like high blood pressure, risk of high blood pressure, palpitations, if someone has any kind of arrhythmia or any kind of heart disease, that can get worse if it's not controlled. But I do want to say that these medications can be used safely if the primary problem is properly treated.
Right.
Then usually it does not get worse. It's only when the other condition is also active and we go ahead with a high dose of a stimulant, then it's likely to get worse.
And I think, I want to know your opinion, I think the same is true for the concern about addiction. If this medication is changing your life for the better, you respect the medication, take it as prescribed, and just what is your experience in prescribing medications for people with ADHD and their risk of becoming addicted to this medication? What's your experience with that clinically?
So actually, I have experience with dual diagnosis patients, which means that patients who once had a history of a substance use disorder. And what we know is that actually if ADHD is appropriately treated in childhood, it really reduces the chances of developing addictions later on. Like children who are not medicated might get addicted to cocaine because in part they are self-medicating. Or if they're feeling anxious, they might go for downers like alcohol or opioids. So one thing is early treatment, early intervention with or without medication can prevent those things from happening. And if the stimulants are, yes, they are chemicals that can get addictive, but if we provide education to the person before we prescribe them, if we teach them how to use them, that they feel comfortable taking gaps 1 or 2 days in a week. They feel comfortable with long-acting formulations of drugs. We make it clear that they take it as prescribed. Then the risk of dependence is not that high. It mostly happens in my experience where the person is relying only on the stimulant.
Right.
They're taking higher and higher doses. So asking for early refills a lot of the times, right? If it happens once, that can happen to anyone, they lost a bottle or something. But if it happens repeatedly, then we are concerned. Right. If they appear to be really jittery, I've had patients who've come in and they were I could see that they're very, very jittery. And so then you wonder what's going on. Right?
Go ahead. So, I think that it's like any other medication. If you take too much blood pressure medication, you will pass out. Your blood pressure will go too low and you'll faint. You have to really respect all the medications. They have a purpose. They're a tool. They're not the answer. So someone may really take this medication and get back a good bit of functioning, but more may not get them to even better functioning. So it's a mindset of where is it that I want to get, what's helping me, and going for it could be better may make things a little bit worse. So there is definitely a mindset of what other tools can I use.
Yes.
It's just one tool. You need other tools. The medications aren't as much as we do think they're very helpful. There's other tools available to you as well.
Absolutely, absolutely. And that's very important because, again, remember that the stimulants don't actually change anything structurally in the brain.
Right.
You mentioned a traffic jam. It's like that. So the stimulant is just the traffic light that's regulating the traffic.
Right.
But once it wears off, there'll be another jam. Right. Or once the amount of traffic changes or the situation changes, people's demands change, they will be in the same bind. Right. So we should look at those as a facilitating functioning, not really the cure.
Right.
There is no cure for ADHD because it's not a deficit like that. It's a state of dysregulation. And we are just fine-tuning it with the stimulant. And a person, while they are on a stimulant, they can actually engage in therapy. They can actually focus and learn practice the skills. And after some time, they might not need it.
And plus, you are mentioning about the side effects, and we have seen recent studies showing the impact of long-term use of stimulants, like being treated with stimulants for many, many years, how this can impact your health, especially your heart condition. So, I'm wondering, thinking about this, how do you approach when you are like treating your patients and someone that is like treated with stimulants? How do we advise them in terms of psychotherapy, in cognitive rehabilitation? Which strategies do you recommend to them? What kind of additional non-pharmacological treatments you advise them to engage?
So, based on the evidence, mindfulness-based interventions have had evidence in improving attention span, different aspects of functioning, executive functioning. There is cognitive behavioral therapy, which is more focused on changing behaviors and thoughts related to thoughts which are causing anxiety or depression. So those have been modified to fit ADHD symptoms and help the person to, again, increase attention span, regulate their mood, treat insomnia if they have that. So I would say CBT, mindfulness, ADHD coaching, which is kind of like they incorporate things from CBT, but also the therapist in there is like a witness, right? So they can really help the person to stay on course, because that is the challenge, that they might start off great, but then they lose track. And so someone to keep on redirecting them and keeping them on one task at a time. And short-term goals and one goal at a time, because the person really would want to do everything at once. And, you know, sometimes that can be really helpful and make them successful, but in a lot of situations, it just distracts them. Other forms of treatment, there's some data on neurofeedback kind of treatments. I actually read some studies on use of TMS in ADHD as well. So, new stuff is coming out all the time. And even I think there are some probably stuff using like some technologies, like some kind of, not video games, but like programs, softwares that can kind of help kids to focus for longer periods of time, exercises like that. So there's a lot out there that we can do in addition to the medication.
So you are talking about side effects, and you mentioned the cardiovascular side effects. Can you talk more about how does the treatment for ADHD impact the heart health?
So there have been some studies lately where they've evaluated patients who've been on stimulants for a long period of time. And by that, I mean like decades, years and years. And, if they're also on higher doses. And, in some of those patients, they did see high blood pressure, risk of, in very severe cases, risk of stroke. Usually in those cases, there was some other heart disease also it could be age related, the natural changes that happen in the body. But on top of that, an activating chemical like this can make everything worse. So we need to be careful, definitely, if someone is taking them for a long time. However, like I said, there are ways to be cautious about the dosing. There's ways to limit the dose or the frequency of dosing. People can give gaps. And usually when I have a person with a history of cardiovascular disease, for example, I have a couple of patients with SVT, which is like a form of palpitations, right, when the heart races. And so in those patients, I actually coordinate with their cardiologist and we talk together and we come up with the stimulant after a little bit of trial and error that doesn't give them palpitations.
Right.
And they actually then might put the person on metoprolol or something else for the palpitations.
Right.
So
a
you
beta
can
blocker
balance
to
it.
slow down the heart a little bit. Yeah. It's definitely collaborative care is always the best for sure. Or there's other non-stimulant choices that you mentioned before. And of course, we definitely do want to emphasize the other types of treatment that are available that are non-pharmacologic. It's very important.
Absolutely.
So you were talking about substance use, and we have seen an increased number of people using cannabis, marijuana. How does it impact people with ADHD, and how does it can interfere with the treatment?
When that happens, it's a little bit of a problem because marijuana, from the latest data, we see that it can actually worsen long-term anxiety. It can worsen things like motivation. And low motivation might already be something a person with ADHD struggles with. So there are aspects of ADHD that can get worse with marijuana. So it's counterproductive. I will often talk to patients that it's not about legality or any kind of moral discussion. From a scientific perspective, the data says that marijuana doesn't help psychiatric conditions. It might make them worse. And it also, clouds the diagnostic picture. Then you're not sure if it is the mood change or the lack of concentration is because of the marijuana use, or the person already had it and it got worse with the marijuana use. So the main thing is that, it can worsen psychiatric conditions. And secondly, I also tell patients that even if it is prescribed for pain or something else, like a medical marijuana card, and they're going to a dispensary to get the marijuana, that is safer than street marijuana, of course. But there is no FDA that regulates those dispensaries as yet,
Correct.
as far as I know.
Correct.
So, it says CBD to THC ratio, where THC is the addictive part, but no one checks that.
Yes.
No,
So-
we had an episode on that. We talked about that. And it's quite variable. It's wildly variable. You'd think this is a small amount of marijuana by its name or what's on a little card in the dispensary, and it actually has 50 times that.
Exactly.
It's not regulated as
It's not
Exactly.
regulated. And the potency of marijuana now is much higher than what it used to be. Over time, it's increased. There's also synthetic marijuana, which can be dangerous for the organs. There's also substances that it is laced with sometimes.
Right.
So it's a safety issue. It's not that sometimes patients ask me, hey, is your Zoloft any safer? Like, isn't that a chemical also? And a chemical you have made in a lab. This is a plant. This is an herbal thing, natural. The answer is that, yes, it is synthetic, Zoloft or any antidepressant, but we've studied it extensively and it has not shown to do any harm to the brain or make anything worse in terms of psychiatric illnesses. Because there are things that medical marijuana has indications for, like pain, but for our illnesses, it doesn't have that evidence. Also, when there is a medical marijuana prescription, there is no guideline on dosing.
Right. Right.
It can be helpful for certain things, but we need more research.
Yeah.
So it's going for something known versus unknown risk.
Yeah, and you mentioned that like people even using for pain, but even on those scenarios, we have to be careful about it. We do have other options to treat pain, and also because it's not uncommon to have people with chronic pain having other, like having mental health conditions associated to that. So we need to be mindful about this and how this can impact your mental health.
So, we've talked about this. Again, I keep coming back to the term spectrum. There's a spectrum of ways this can present, ADHD can present in someone's life in time when it affects you. The medications that we can use are a spectrum. So there's a lot of different things to consider. But let's talk to parents for a second, because this is often in front of parents. A lot of times they'll get a call from a teacher. I think, your son, your daughter is showing symptoms of ADHD. You should go get them tested. But as a parent, you're trying to make all the right decisions, and you're trying to not do any harm to your child. And for certain groups, there's been a disproportionate diagnosis of ADHD, so you're a little wary. So what advice would you give parents if you're like, I kind of see it too, but I don't really want to see it, and I don't want to believe that it's true. I don't want my child to be on, these sound like very strong medications, so I don't want my 9, 10, 11-year-old child to be on these medications, but I'm also concerned that their future could be impacted in listening. Like, there are some things here that are concerning. What should a parent do to be able to really be able to face this question and get an accurate diagnosis and get input? And how would you recommend they go about doing that?
Sure. So the first thing I would tell a parent is to take a breath.
Yeah.
That this is not a problem, that they did something and this happened. is nothing about their parenting that we are talking about. It did not cause the disease. It is something that is well researched, that has many different kind of treatments, not just the medications they are concerned about. They should, again, consult a doctor, a child's doctor, who can then refer them to a child psychologist who can do a full testing, the neuropsychological testing that we mentioned. And then they can refer them to a child psychiatrist who can, in addition to medications, if medications are an option for that child, they can refer them for psychotherapy, they can refer them for some coaching, they can get an IEP at school and get more support, get accommodations. There is a lot that we can do to support the child and them also. I've seen parents also, if the child is hyperactive, parenting can be really, it's difficult as it is.
Right.
So there is help and resources for the parents also to take care of themselves and to know how best they can get their child's attention.
Right.
And help them to study and behavior-wise help them to behave at home at school.
And we're talking about the IEP is the individualized education plan that schools are required to do if there's something that's identified. But I think the other thing that can come out of this that we didn't talk about is it may not be ADHD at all. You alluded to it earlier. There could be other things. You could have a different type of reading disability, like a dyslexia. That can cause people to withdraw, act out in class because they can't really read in the same way other kids read, and that could be addressed.
Absolutely,
and that can be once you know that that's happening. But it's very difficult for 8, 9, 10-year-olds to say, like, I see words different than you because they don't know. This is the only way that they see words. So there's lots of different things that could come about. So just to encourage parents to treat this like any other presentation that's going to happen in your child's life, to get the best advice that you can, make the best decision that you can, and know that it can affect not only the now but the future.
Yeah, I think that is especially important to remember, that we know that children who are treated and their symptoms are well controlled throughout childhood, they can really achieve a lot as they grow up, and we can really prevent a lot of anxiety, depression, and all these other problems, substance use. And they are usually, like I said, it's not a problem of intellect, so they are extremely bright. They can actually then use their strengths and make you proud. So, so it can be really helpful in the long run.
Yeah. And we have seen an increased number of people being diagnosed with ADHD. And I'm wondering, do you think that this could be explained by like a reality of like we have more people affected by the condition, or are we overdiagnosing? Are people having like more access to information, being more educated by this, and as a consequence they are recognize the symptoms, or this is a result of like more accurate diagnosing tools? What is your opinion about that? Why we are seeing this increased number?
I think that both things you said has an element of truth in it. That I think that there were periods of time in history in the United States that, you know, some groups might have been diagnosed more, or education reform or some policies affected ADHD diagnosis and treatment and policies in schools. And still there's a lot of controversy about, is it a real disease or not? Is it just something like in your mind? Are you just lazy? You don't want to do certain things? But ADHD would be more than that. I think that it would be misdiagnosed if someone is not taking, if the clinicians are not taking enough time to really explore everything else and rule out everything else. Because, I mean, not everything is ADHD. You know, in today's world, with so much competition, the fast pace of life, we are all running, right? And to some extent, the ADHD brain can be helpful to survive in this fast-paced world. On the other hand, not everyone who is having, not every kid or not every adult who's having trouble with focus and concentration has ADHD. They might be sleep deprived. They might be. So, you know, in order to make the right diagnosis, it's just important for clinicians to remember that everything else should be considered. It's not in isolation.
Right.
Are there any helpful resources in the community or schools or even online that you'd recommend locally and nationally?
Yes, absolutely. So one online resource that I use and I give to my patients is attitudemagazine.com. So like attitude, but ADD.
Okay.
And they have a lot of resources both for children, their parents, as well as adults with ADHD and different aspects of it. And usually when you go listen to their podcast, in every one of their podcasts, they give out even more resources. So that leads to more resources. There's also organizations like CHAD. There's like sometimes there's like conferences for people with ADHD. They can go and kind of socialize with each other. And there's groups that can help out each other in day-to-day life.
Support groups around a common topic. What is CHAD?
So CHAD stands for Children and Adults with Attention Deficit Hyperactivity Disorder. It's an organization that was formed to support children and their parents and even adults with ADHD. It has, again, like Attitude Magazine, has a lot of resources both for kids. Also for parents who want to get their kids tested, if you go to the Attitude Magazine resources page, they have a directory of providers by state.
Oh, helpful.
And showing what insurances they take and everything.
Okay.
So it can be really helpful.
Good. And CHAD is CHADD. Got it. Okay. So now tell us about your upcoming book on
Exciting.
on ADHD.
So the book that I'm working on right now is on neurodevelopmental disorders. So a little bit more than ADHD. We are also covering autism and learning disabilities like dyslexia, and how it presents in adults, firstly, and specifically adult women. And the second part of the book is perinatal, which is now my main area of work, how it presents in pregnant and postpartum moms, and then strategies to help the moms to cope with it. So I'm working on it right now, and it is half done, and hopefully it'll be done.
It's a tall order writing a book, so we wish you the best of luck, and we can't wait to see it come out.
Thank you.
And thank you so much for joining us. It was really helpful. We appreciate you being here and provide this information. Thank you.
Happy to be here. You're welcome. Thank you.
Thank you. Our take-home message to bear in mind.
So ADHD is a common condition that affects people's ability to pay attention, to focus, and to control impulses. Signs of ADHD are most commonly presenting in childhood and often persisting through adulthood. And recognizing and treating ADHD can improve functioning in many areas. And remember that it's a disorder that's a spectrum. It presents in many different ways.
With consistent support and appropriate care, from classic treatments to new therapeutic strategies, there is a path to overcome the challenge related to ADHD and build a fulfilling life.
And as always, if you or someone you know is feeling depressed and having suicidal thoughts, please contact the Suicide and Crisis Lifeline. Call or text 988 or access 988lifeline.org.
Thank you for listening to our podcast. For more information and related content, please check out our Instagram, X, Facebook, and YouTube channels. Bear in mind the Brown Psychiatry Podcast. Thank you.